Some of you don't have it yet, and it's one of those pieces. This is the SmartHeart Premium Talking Blood Pressure Wrist Monitor. These are the kinds of things that I think every home should have, because when it comes to knowing your blood pressure numbers, these are your vital signs. When it comes to knowing them, you can't just look in a mirror and say, oh, I'm fine. For some of us, we need to know those numbers on a very consistent basis. But for others, having this at the ready when you have had a stressful day or when you're feeling something just makes all the difference. Easy to use, and we're gonna show you how it works. We do have a price break on this one, and we also have flex pay. So as we talk about the blood pressure wrist monitor, when we talk about vital signs, this is what it is.
It is the most important thing you can do. All of these things we're talking about for products, folks, they go together. So you want to start an exercise program. You want to get rid of your leg swelling and be comfortable. You want to know your numbers and know what's going on inside your body. It's absolutely paramount that you do so. So let's take a look at the information that you're going to get with this monitor. It's one of my favorites. You're going to get your systolic over your diastolic. You're going to get your heart rate. It's going to interpret your reading for you, just like Veridian always does on their units with this hypertension indicator. You know why this one is so special? Not only is it going to talk and tell you your readings, only when you want to, you can mute the voice. I want you to know that. And it's going to do it in 3 languages, English, French, and Spanish, but it has 4 memory banks in this tiny wrist monitor. So you get just shy of 400 readings in memory. So you have 99 readings for each of 4 users. So I want to show you how simple it is to get there, because I know that a lot of you are frustrated with how difficult things can be. So I press that set button over here. I'm going to press the memory, that button right here. So that's going to change that to user 2. User 3, user 4, I'll go back to user 1. I'll press this middle button to get me back off to where I was. And that's it, simple as that. And I'm ready to start and go with this. So it's gonna give you those clinically accurate readings. And again, up to 400, just shy of 400 readings in memory. It's a true family unit, an absolute bargain at this price.
It is, and I like that. That's the most I think we've ever seen or heard in terms of that memory bank. And why that's important is that if you and your family and your spouse maybe are checking your blood pressure on a daily basis, and then maybe you want to take that information to your doctor, you're not sitting there trying to remember or write it down or even wonder, is this good or not? Very simple.
Yeah, and I'm kind of giving that a chance to show everybody how it talks. We're gonna do that live too.
Okay.
So pretty exciting moment here.
Your systolic pressure is 97 millimeters of mercury. Your diastolic pressure is 67 millimeters of mercury. Your heart rate is 63 beats per minute. Your blood pressure is optimal. Measurement complete.
Ooh, I like that.
Yeah, and let's do that live here with Jen. So we have Jen here on the couch, and she's gonna place the monitor right on her wrist. So you see it's very comfortable. It's gonna fit a wide range variety of wrist sizes. So hook and loop, very simple and comfortable. One button to get her going, and I'm gonna slide closer so my mic can pick up on this for everybody.
Please ensure that the cuff is at the same level as your heart. Do not move and keep quiet. Now if you are ready, let's begin.
Okay, so this is only gonna take about 25 or 30 seconds to get that clinically accurate reading.
Okay.
Now you see how it actually counsels you through how to set up in the proper position. Now, just a full disclaimer, Jen is moving her arm to the side so that you can see this at home, but ideally she wants to be, you know, comfortably seated, feet flat on the floor for 10 minutes or so until she's nice and resting with that heart monitor at heart level.
139 millimeters of mercury. Your diastolic pressure is 91 millimeters of mercury. Your heart rate is 81 beats per minute. Your blood pressure indicates mild hypertension. Measurement complete.
Okay, and what you didn't see at home was Jen's face when it said this indicates mild hypertension. She kind of did one of these. So, but you don't need to do that. You know, the important thing is, you know what your reading is. You can keep that information and trend it 99 times for you and 99 times for 3 other family members, and take that information to your doctor. And one higher than normal reading doesn't mean you have high blood pressure necessarily.
Okay.
It just means you had a higher than normal reading. With a clinically accurate device that kind of walks you through this when you need it in 3 languages, you can get that clinically accurate reading and just recheck it in a few minutes and see if you get that reading more closer to your normal.
And see, that's why these are the kind of things that we should have at home, because like you said, one high out of the range reading doesn't diagnose anything. But when you go to the doctor, they take one reading. But just for the time that you're there. And so you feel like, well, everything's great or everything's not. The idea is consistency and over time. The idea is to get a trend, and that's what having this at home does. I also like that it talks to you, because if it's harder for you to see, if you can't find your glasses or your contacts for whatever reason aren't working properly for you, you don't have to wonder, was that a 6 or was that an 8? I couldn't really tell, because it's gonna tell you.
Yeah, it's perfect in those low light situations, and a lot of you take your blood pressure like my mom does, kind of in the middle of the night. Sometimes she'll get up and check it. You don't want to turn the lights on in the house. You want this to talk to you. You can set it accordingly. So why are we doing this? And we talk about these statistics all the time, because I just need to wake everybody up again. 1 out of 3 of us, so 1 out of 3 of us here on the couch is gonna have high blood pressure in this country. Wow. So that's about 75 million of us, and another 75 million of us has pre-hypertension. So we don't even have a diagnosis yet of high blood pressure, but it's going on all the time. And over time, that effect on our bodies is going to lead to the heart attacks and the strokes. That's what we want to avoid here. So the really scary thing is, the 1 in 3 of us that has high blood pressure as a diagnosis, only about half of us have it under control with our medications or diet or exercise. So down the bottom there, it's costing us about $46 billion a year. You know, I don't have 46 billion, and I know none of us here do, and if you do, I'm gonna ask for a loan right after this. But it's costing you money in hospital bills, medications, all of those things, and tragedy. My mom had a heart attack years ago. Her doctor's takeaway was, you need to check your blood pressure every day now that we have you out of the hospital and you're okay. So folks, please get this home, check your blood pressure every day, and I'm all about simplicity.
Yes.
And so I wanna show everybody here. Take a look here. So I'm gonna turn this back on. I'm gonna cycle through some of those setting functions to go to where the voice is. So here's the voice. I have mine off.
Okay.
So it said English,
Español.
Spanish, French, off. Okay. And then I press that middle button again. So just simply, just like that, in a couple of seconds when you're used to this, you can put the voice in any language, or you can mute it. So you don't need to have everyone around you knowing what your blood pressure reading is. I don't want you to think that either. This really has that added benefit, which is wonderful.
It does. And again, super simple to use. The SmartHeart blood pressure monitor that goes on your wrist. You can take it anywhere, because it does come along with its own case. So maybe when you are traveling or away from home, maybe it's when you're going to visit your sister, and that's where your blood pressure is always higher, your sister's house, or whatever the case is.
Why are you looking at me?
Then you know.
I love you,
you
sis.
can keep it track.
No, and it comes with the batteries too, with the carrying case, very discreet, ultra portable. Veridian backs you up with a 5-year manufacturer warranty on this too. It's a no-brainer, and as a registered nurse, I completely recommend getting this home today.
You can get it on FlexPay. I love that it's a price break, because our regular price is $50. We took about $10 off. You can spread the payment out using any major credit card, and you get this home and you have it. You don't need one for every member of your family, just one for your household, because it can hold up to nearly, was it
just shy of 400 readings.
400 readings. Yep. And this is something that I know you're gonna get a lot of use out of once you start using it. High blood pressure is something that can be controlled, but only if you know about it.
Don't have your head in your sand.
For sure.
In this sand.
Or your sand.
Or your sand.
Thank you, guys. And you can keep shopping. I know that we do have to move, but this one